breathless, violently shaking and visibly distressed. For Dr. Kelly Fearnley, this was the reality of living with long COVID. She says she contracted the illness while working on a COVID ward. Nearly 4 years later, she's still struggling with its impact.
At one point, I didn't want to continue with life. Long COVID's impacted every area of my life. So it's not only affected my health, it's taken away my ability to work and earn a living. It's affected my long-term hopes and dreams for the future.
Because she's still housebound and worried about infection, Dr. Fearnley spoke to us on Zoom. She is now part of a group of hundreds of doctors planning to sue the NHS for providing them with what the collective consider poor equipment on the front line.
I know several doctors who have been forced to sell their homes. Many would be homeless now, if not for the support of families. I know some doctors that are now having to use food banks. Many of these healthcare workers contracted COVID whilst providing care, vital care for patients.
Bond Turner, the law firm representing the group, claimed the NHS downgraded guidance in March 2020 for staff to only wear blue surgical face masks and plastic aprons, while both the NHS and the World Health Organization were only suggesting using FRSM, fluid-resistant surgical masks. Both the US and European public health authorities advise at least FFP3 or N95 masks for healthcare workers. The UK HSA said guidance was published which advised that FFP3 respirators be worn by healthcare in keeping with guidance published by the WHO, while the Department for Health and Social Care said throughout the pandemic the government acted to save lives and livelihoods, prevent the NHS being overwhelmed, and deliver a world-leading vaccine rollout which protected millions of lives across the nation. Meanwhile, experts say it's impossible to be certain about the origins of a COVID infection. For Dr. Fearnley, there are still plenty of physical and emotional reminders. She traces back years of suffering to simply trying to do her job, protecting the public in the hardest of circumstances, which is why she feels more could have been done to protect people like her. Shingi Marike, Sky News.